Hi, I'm Annie Sleece, and I'm on the staff at NAMI Delaware. This is a part of a discussion series focused on back-to-school community resources. We're talking with state agencies who work to support youth and families in Delaware. But before we begin, I'd like to give you a little information about NAMI Delaware. NAMI stands for National Alliance on Mental Illness. We're the Delaware chapter of the national organization, which is the largest grassroots mental health organization in the country. There are NAMIs in every state and hundreds across the country. So if you're outside the state of Delaware, you can find your local chapter by visiting NAMI.org. NAMI Delaware offers support, education, and advocacy to those affected by mental illness, not only for those diagnosed, but also for those who care about them. You can learn more about us by visiting our website. And there you'll also see other mental health related resources available in our state. Just click the Education tab and select Resources. NAMI Delaware is not a crisis response agency, but there are resources available for you 24/7 should you or a loved one need immediate crisis response. You can text DE to the National Crisis Text Line, 741-741, or you can access Delaware's Hope Line through the number on the screen. Today, we're talking to Sheba Brown from Catholic Charities about the program called CORE. Welcome, Sheba.
Hi.
Hi. Thanks for taking a few minutes during this busy back-to-school time to talk about your work. Can we start with your job title at Catholic Charities and with CORE? Tell us what your job is and a little bit about yourself.
Sure. I've been with Catholic Charities, kind of new, but with Delaware CORE, which is part of Catholic Charities. I've been with Delaware CORE for about 4 years. Delaware CORE is a grant-funded program, and I've been program manager and clinical coordinator currently at Catholic Charities with Delaware CORE.
Great. And so I guess I have to ask the obvious question about COVID, right? So how has that affected the world? It's been 18 months for all of us, and I would suspect that at CORE and with Catholic Charities, it's changed the way you do your work. Can you talk a little bit about that?
Well, yes, of course. Initially, with us dealing with CORE and COVID, we were actually at home doing everything via Zoom, like the rest of the world was seeing clients, patients via Zoom. And then I think about maybe May, we came back to the office and we found out that people actually want to come into the office when they had the option to, do via Zoom. They were electing to come to the office, which we thought was kind of interesting, needless to say, but they're still opting in to come to the office. I'm just curious what's going to happen when it's back to school and we're back to the hustle and bustle of, dinner and homework and everything. So it'll be interesting to see what's
Sure. So are you offering any virtual services as well, or is it still optional?
I'll leave it optional for anyone who's more comfortable home, because now we're going to be inside and things might change. We might be back on lockdown. Hopefully not, but keep it optional.
That's great that you can have that flexibility for those you serve. That's terrific. Thank you for sharing that. So let's talk about the work you're doing with CORE. Tell us a little bit about it. For those who are viewing right now, they might not have even heard of it. So can you tell us what CORE is?
So Delaware CORE is about 6 years old. It was a grant-funded program to kind of address early signs of psychosis. So we were a statewide program now, which is focused mostly in Newcastle County. But as a statewide program, initially we addressed those who were diagnosed schizophrenic and those who were also considered to be at a high risk to develop schizophrenia. So or psychosis. So there were 2 separate categories that we addressed. And now with CORE 2, which sometimes I would mention, we are solely focused on addressing individuals with clinically high risk to develop psychosis versus individuals who already have been diagnosed with some form of psychosis and or schizophrenia. However, we do see them as well, but they need to be 18 and older here at Catholic Charities. So it gets a little dicey to kind of, distinguish between the two. I just say refer to our program and then will decide at that point when you make that 888 call whether you qualify for our age range or not, or for our conditions. So we treat individuals ages 12 to 25, mostly in the county of Newcastle. And so there are certain requirements that you have to meet prior to someone assessing you as myself. So the first thing you have to do is sometimes fill out a PQ16. And PQ16 is just 16 questions addressing some of the symptoms you may or may not be having. Depend on how you answer or respond to the PQ16, then you may qualify for referral either from a clinician, or you may say, oh, wait a minute, I have a lot of these symptoms. Let me give this number a call. And then when you give this number a call, then someone, Dr. Shirley, will ask you further questions. And then after those further questions she may ask you, you may qualify to then be assessed by someone like myself. And at that time, I ask you a bunch of questions. Sometimes it can take up to 2 hours to see if you qualify for our program. What our program offers that other programs don't offer is that we are focused solely on CBTP, cognitive behavioral therapy for psychosis. And a lot of programs might offer cognitive behavioral therapy. A lot of therapists might offer cognitive behavioral therapy, but this is strictly just for psychosis. We also have family sessions. So what that will look like once you're into the program is the first 3 sessions are family sessions. Then thereafter, we teach you, the parents as well as the child, in family sessions, all about cognitive behavioral therapy. Also all about paranoia and what that looks like and how to deal with it. So by the time you completed our 9 to 12 month program, you will have 30 skills on how to deal with someone who have early symptoms of psychosis or someone who've already developed psychosis. So that's what's unique about our program. And as well as those family sessions, we're teaching the family how to reduce the noise in the household. We're teaching the family how to interact with the youth. We're teaching the family exactly what is going on, what does this look like, as well as we're teaching the individual. And so what we learn is that there's a lot of communication in the household that is increased versus what was there before, and a total misunderstanding and lack of communication when it comes to these type of symptoms. So after you've completed our 9 to 12 month program, you leave our program and you are armed with all kinds of cognitive behavioral skills that is sometimes used just for psychosis and sometimes used for other things as well. So what a therapist will learn and what I took a few weeks to learn, a parent as well as a youth are armed with the same thing. So that's what's unique about our program, as well as then we'll have individual sessions to address some of those symptoms that you may be experiencing on a regular basis.
Wow.
So we meet with our parents every week.
Every week. That's great. I love the component for families. That's so amazing, because I think sometimes when, with the work NAMI Delaware does, we work a lot with families who are supporting someone who might be experiencing significant mental illness. And sometimes families just feel left out of the system. They feel disconnected. They feel like they don't know how to help. And so it sounds like the Core 2 program is really folding in that piece that's so important to the person experiencing, in this case, elements of psychosis or schizophrenia, which is just sounds really powerful. Now, after someone exits your program, is there, do you connect with them at all, or is the program so young that you haven't had the chance to yet? I just wonder, like, long term, are there plans to follow up or anything like that?
So because it's a grant-funded program, we have some, we partnered with Westchester University. And Westchester University gathered some research at the beginning. So we ask you a bunch of questions about mood and what you're feeling and symptoms, and it's a few assessments. And then we assess you again at 6 weeks. And then we assess you again around the 6-month mark, and then 12 months, and then 18 months. So the researchers at Westchester University will contact you by the time you're done with our 12-month program, there's not much else we can do basically to, follow up with you basically to, well, I mean, you've learned it all in
Right,
other words.
right.
You know?
Yeah. You've laid the foundation, right?
Yes,
Yeah.
exactly. But at that time, you will have learned, here are some of these symptoms they were talking about. I need to address someone. I need to call someone. I need to help, I need help figuring this out.
Right. Right. And it's so important too with such a diagnosis that carries such stigma as schizophrenia, or just thinking of the cluster of symptoms that is psychosis, right? People don't really understand what that is, and they can be so fearful of even addressing them, whether it's for themselves or for a family member, because of the misconceptions about it. Do you want to address any of those myths or assumptions that people make, and clarify anything regarding that?
I would love to. Oh my gosh. When we started Core One, one of our goals is to kind of reduce the stigma with the word psychosis. And not just with the general public, but with also professionals. Because, they also think that, okay, psychosis, that's just a lifetime thing. And all right, and then when you think about the public, they think of their image might be someone with psychosis and someone talking to themselves, pushing a cart, a homeless person, someone who, doesn't fare well in society. And that can be far from the truth. Dealing with someone who has a psychosis and early signs of psychosis, especially, they are usually the ones that are picked upon and not the aggressor, which is sometimes what the stigma is, that, oh, they're crazy, they're going to hurt me, they're, watch out for them. And that is so far from the truth. Actually, they're usually victims of violence. And when we have clinically high risk or CHR individuals, their symptoms look very, just don't wake up and see someone talking to you. So while we address clinically high risk in our program, because what it starts to sound like, it might start to just sound like a shower running in your ears constantly. It may be, I'm just sensitive to light, so I wear sunglasses. It may be, I feel, I always feel like something is crawling on my legs. It may be hearing a whisper, or I'm smelling something that no one else is smelling. Those are early signs of, psychosis, and or early signs of developing those symptoms that would lead maybe to psychosis. So we try to intervene early and say, hey, listen, this is what's going on with you. And so kind of say, hey, this doesn't have to be a lifetime thing. And that's when the CBTP portion comes into the program. And we partner with Mount Sinai, and we meet with them every Thursday to address anything that might seem, unfamiliar to us and our client. And then we address it as well as the individual who designed the entire program for us. So yes, we do want to reduce the stigma for psychosis and reduce the stigma of anyone who are having early signs and symptoms of psychosis. I just want to stress that, because the earlier, the better, just like any other condition. The sooner we get in, the better we can help you.
That's right.
And the more active you are in participating, the better your outcomes would be. So I just want to stress that portion of it.
Yes, thank you so much. Now, if viewers want to learn more about this, how do they find you?
So you can contact us one or two ways. You can either visit our website, and on our website, it will have our phone number as well, and also a fax number where you can fax us, or you can email us. And I think there's an email correspondent you can have, but I would strongly recommend visiting the website first and then giving us a call if you have any further questions.
That's great. So check out that contact information available on the screen. And I have one more question for you. I'm going to ask this question of all of our guests for this discussion series. So, and here's the question. If you had one message of hope or advice or some sort of reminder when it comes to Delaware caregivers watching right now, as we begin this back to school season, what would that be?
It gets better. It gets better.
I love
That's
it.
all.
I love it. That's perfect. Thank you so much. And thank you, Sheba, for spending some time with us. Check out CORE and reach out to Sheba if you have any questions. And NAMI Delaware is here to support you as well. Have a great day, everybody.
Bye.
Bye.